I'm Leah Lando along with Mark Gruba, and we hope you are well. A lot of news today from officials. Governor Cuomo urging everyone, stop panicking, listen to the facts to stop the spread.
Two big announcements from the governor as well today. First, 75% of workers must now work from home. Governor Cuomo said this morning no more than 25% of non-essential employees should be reporting for work. There are now more than 4,000 cases of COVID-19 in New York. About 19% of those with the virus are in the hospital. To reduce stress, Governor Cuomo is putting a pause on mortgage payments for 90 days for those who are out of work due to the virus. The mortgage relief plan will also put a pause on pending foreclosures. Governor Cuomo says the biggest hurdle New York must overcome is access to necessary hospital equipment.
What is going to be the issue in the healthcare system? It's going to be the number of hospital beds. It's going to be the amount of protective equipment. And most of all, it's going to come down to ventilators, a piece of equipment that up until now was relatively inconsequential. But when you have respiratory illnesses and then this volume of respiratory illnesses, all of a sudden the number of ventilators becomes critical.
Well, New York reportedly has about 6,000 ventilators available. The governor says the state needs about 5 times that amount.
Another important piece of information here. Not everybody who is sick will be tested. That is the message from health officials today. They say testing is limited and not necessary for those with mild or moderate symptoms. Doctors from UR Medicine say 80% of COVID-19 cases are mild and patients will recover on their own at home. The key is to stay home, self-distance, and manage your symptoms.
At the moment, there are no treatments that are recognized at this point. There may be treatments in the future that we'll all, of course, embrace. But at the moment, if you have a positive test or a negative test, the treatment is pretty much the same. For most people who have this infection, more than 80% of them, it's going to be a cold, might be a bad cold, or it might be like the flu. You have to stay home, take liquids, maybe take Tylenol or other fever-reducing agents. The treatment is the same. So knowing a positive or a negative test is not going to make a difference in what your doctor is going to have you do. Staying home is number one.
All right, health officials also say thousands of people have already had COVID-19. Many don't even know that they had it. This is about protecting those most at risk, older adults and those with underlying medical conditions.
There are now about 30, or I should say exactly 30 confirmed cases of COVID-19 in Monroe County. 7 of those individuals are in the hospital, we're told. 195 people are currently under mandatory quarantine. 6 more people will be tested today thanks to contact tracing. The Department of Health is also investigating the movements of one patient. That patient flew in from JFK in New York City to Rochester this past Saturday, March 14th. The Health Department is asking anyone who may have been on that flight, Delta Flight 4824, arriving in Rochester at 5:55 that day, or anyone who may have been inside the airport terminal at that time, to monitor for COVID-19 symptoms. The individual with COVID-19 has been under isolation since they arrived.
We have reached the individual. I personally conducted that contact tracing investigation myself, spoke to the individual, spoke to that person's family. To this point, we do not identify any other high-risk contacts from that individual. We are working with the State Department of Health to obtain the flight manifest from that inbound flight from JFK. But at this point, the guidance is that if you were on that flight, to follow your symptoms.
And again, to reiterate, the individual with COVID-19 has been under isolation since they arrived back in Rochester.
All right, some promising news. The number of new coronavirus cases in China is dwindling. Authorities reporting only 34 new infections in the past day. All people arriving from other countries. No new local infections were reported for the first time since the outbreak began last December in Wuhan. And we leave you with this today. Cuomo said, we're fighting 2 wars. One is on COVID-19. The other is on fear. If we continue to do what we're supposed to do, social distance, like we're doing here, washing our hands, staying home, following officials' orders, then we can fight coronavirus.
And the president says the FDA will fast-track antiviral treatments for patients with COVID-19. For details on that and much more, head to rochesterfirst.com. Thanks again for watching.